Now, here are some 3D images of a normally placed T-shaped Paragard IUD. Here are the horizontal stems and the vertical stems. Here in the coronal plane, again, this IUD is in optimal position. With 3D ultrasound, one can also use the multi-slice display where we have multiple parallel slices in the same orientation. And we can see here another T-shaped IUD. Notice that one of the horizontal arms is located in a slightly different plane than the other arm, but by going through the slices, one can determine that the IUD is intact and in fact is in a good location, as is this T-shaped IUD. Another Paragard IUD in a normal location. Here we see the characteristic double echoes of the horizontal arms, and with the rendered 3D image we can actually see the string of the IUD as well. Here is a copper T-shaped IUD in a patient with an arcuate uterus, so it is a little bit lower than ideal, but given the fact that she has an arcuate uterus, this is probably an acceptable location. Here a slightly older case, an IUD that appeared in the sagittal plane to be either normal or slightly low in position. When we explore the location of this IUD using 3D sonography, we note that there is the shadow of the long stem here, and then when we manipulate the volume further, we can detect that there is embedment of one of the horizontal arms into the myometrium of the lower uterine segment. Here's an example of a Mirena IUD that is in the uterine cavity, but in which the very echogenic string simulated the IUD being in the cervix. So these are the initial 2D images, and we have a highly echogenic structure in the lower uterine segment and cervical canal. There were just a few little echoes, foci of shadowing in the upper uterine cavity, and the initial impression was that this was actually an IUD on its way out. But further evaluation with 3D ultrasound was very helpful because we could use the artifact, the shadowing from the Mirena, which itself is not terribly echogenic, but we could use the shadowing to image it. And here we see that the Mirena is in fact in a very good position, and what we were seeing was the echogenic string. So sometimes it's necessary to use the artifact from the IUD to actually confirm its position. This woman had some abnormal bleeding and a history of polyp, and the concern was, is the IUD causing the intermenstrual bleeding, or is there another polyp? And here we see in the coronal plane, pointed to by the yellow arrow, that there is minimal myometrial embedment or penetration by this horizontal arm. We actually performed a sonohysterogram to assess the cavity because there can be some difficulty assessing the cavity in the presence of the IUD, and demonstrated that there was no polyp, confirming the myometrial penetration here. And the clinician was pleased as long as there was no polyp. The intermenstrual bleeding itself was not clinically significant. Now here is an example of the Mirena IUD. Notice that there is a curvilinear bright echo in the cervical canal. Then when we get to the uterine cavity, we see multiple parallel echogenic lines and extensive shadowing in the sagittal plane. And then when we come into the coronal plane, we have some shadowing from the long stem. And then these are the horizontal arms in a coronal cut through the upper uterus. Again, we have the double echo, but the other arm was not in the same plane and somewhat difficult to see, and therefore our confidence was not great that in fact we could say that the IUD was in perfect position. But again, using the shadow of the IUD to image the IUD on 3D ultrasound, we see that in fact the IUD is intact and is in a normal location. Here again is the echogenic string. Here another example of the string looking very echogenic, some shadowing from the long stem of the IUD. In the coronal plane, very difficult to see the horizontal arms of this Mirena IUD. Here is a cine clip, which can be helpful. Again, we see some shadowing from the long stem of the IUD, but hard to be sure about the horizontal arms, although we can see some punctate echogenic foci as we go through it. Again, much easier and more confident identification of this IUD using the 3D ultrasound. There's no question that this is nicely placed in the endometrial cavity. And here is the string that had withdrawn into the uterine cavity and therefore was not clinically palpable. This 32-year-old woman came in with abdominal pain. You can see here on the topogram from the CT that she has a Mirena IUD. The CT can tell us that the IUD is in the general vicinity of the uterus here in the lower uterine segment, but does not give us precise information about the location of the IUD with respect to the uterine cavity. We see in this case that there is some infiltration and streakiness of the pelvic fat, and in fact she had an acute early PID. Another example of a woman that was referred because of a lost IUD string. In this case, the IUD is highly echogenic with shadowing. This is probably a little bit of the string. The horizontal arms here are seen nicely, not much question. In this case, with 3D ultrasound, though, we can see what happened to the string. It didn't break off, but it's curled up in the uterine cavity. And here a plain film on a woman. Again, the question was, is the IUD outside of the uterus? Because the string could no longer be palpated. When you look on a plain film, you know the IUD is someplace in her body, in the pelvis, but you really can't say where it is because we can't define the location of the uterus. Here on ultrasound, we see the echogenic string. Again, we see the linear, multiple linear parallel lines that represent the vertical stem of the IUD. The Mirena, the horizontal arms are here, but difficult to see with confidence. Again, a 3D ultrasound showing that the IUD is in a good position. Keep in mind, again, one needs to remember that the distal aspects of the horizontal arms of the Mirena are bent inferiorly, and you don't want to call that a broken IUD. Now here's a topogram from a CT in a woman with a copper T IUD. You see it's much more radio-opaque. She presented with abdominal and pelvic pain. Here we see that there's some beam hardening artifact related to this metal IUD. Notice, again, we can say that the IUD is someplace in the uterus, but very hard to judge on CT exactly where it is because we don't really see the cavity distinctly. Unfortunately, in her, on ultrasound, we see that this copper T IUD is located low. It's in the lower uterine segment and in the cervical canal, the upper cervical canal. And in this case, we demonstrate an artifact which mimics fragmentation of the IUD. This is the long stem here, seen in cross-section with shadowing. And we actually see 4 echogenic structures radiating around the long stem. And the first time that one observes this, it can be rather confusing. Has the IUD become fragmented? What's going on here? Is there more than one IUD? This is a video clip. Notice that of these 4 echo densities, 2 of them are more echogenic and 2 of them are less echogenic. In fact, this is an artifact related that one sees with the copper IUDs. These artifacts can mimic fragmentation and should not be mistaken for an abnormality. There are quite a number of articles in the literature recently in the last couple of years because of the increased use of IUDs both for contraception as well as for the treatment of abnormal bleeding, and I encourage you to become familiar with these other applications of the IUD because you will be seeing them in perimenopausal and menopausal women and in women being treated for endometrial hyperplasia. And there the concern is not so much contraception as it is making sure that the IUD is in place in order to effectively treat the problem. What next? What if an IUD is known or thought to be present but not visualized sonographically? Further evaluation may include a plain film, which will document the presence of an extrauterine IUD but not the exact location. CT will show the general location of the IUD and of course is very good for identifying associated complications. Finally, a comment about the MRI. MRI can show the IUD as a signal void. Keep in mind that the safety of all of the metal-containing IUDs at the high field strength of 3T has not yet been proven. So in conclusion, intrauterine devices are increasingly being used for reversible contraception as part of hormonal replacement therapy and as treatment for excessive uterine bleeding and endometrial hyperplasia. There is a lot of excitement regarding the application of the IUD for the latter indications because we may be able to reduce the need for endometrial ablation and hysterectomy. Ultrasound plays a critical role in the evaluation of patients with IUDs. It is incumbent upon imagers to be familiar with the appearance of IUDs and the pitfalls in their imaging. And finally, 3D ultrasound may add significant information that can affect clinical management. Thank you.